Good evening, and thanks for joining us on air and online tonight. We have a lot of ground to cover, and as you can see behind me, our guests are already on screen, looking good, standing by, ready to answer some of your questions. Let me introduce them now. They are former Florida Governor, now Congressman Charlie Crist. U.S. Representative Crist serves Florida's 13th Congressional District in Pinellas County. Congresswoman Kathy Castor is representing Florida's 14th District, which includes most of Hillsborough County, as well as Tampa. Florida Senator Darrell Roussan serving the 19th District, covering parts of Pinellas and Hillsborough County, including Tampa and St. Petersburg. And of course, we have Tampa Mayor Jane Castor, former police chief and member of the Hillsborough County Coronavirus Emergency Task Force. Also joining us tonight, Mayor Rick Kreisman from St. Petersburg, and one of the Bay Area's top local law enforcement officials, Pinellas County Sheriff Bob Gualtieri. Again, thanks to all of them for joining us tonight. I want to start with you, Mayor Castor. Phase 1 of Florida's reopening plan is now a week old. So how do you think we're doing in the Tampa Bay area?
I think we're doing well here in the Tampa Bay area. We're taking it very slowly so that if there is a surge, we'll be able to roll back. We started our Lift Up Local program where we're helping our retail and restaurants out by allowing them to move into the outdoor space to expand tables for restaurants and retail onto sidewalks, parking lots, and in some cases we've closed down streets. And we started that last Tuesday. And it's been very, very successful, very well received by the restaurants and retail and the citizens as well. So going very well so far.
That sounds good. Mayor Kreisman, I want to go to you next. Are we ready for phase 2? And if not, what needs to happen first?
Yeah, I think, we really need to have an opportunity to take a look at the data and see what the impact of the steps that have been taken in phase 1 are. Do we see numbers go up in the number of positive tests? Does the percentage change? Does it stay the same? Do we continue to see the track that we've seen here, at least in St. Pete and in Pinellas County over the last week or 2 weeks, where the percentage of positive tests is actually decreasing? Does that continue? So I think we really need to take a look at that before we make a decision that it's the right time to pull the trigger on phase 2.
Sheriff Gualtieri, I want to go to you next because your deputies are out there patrolling our beaches. Everyone wants to get back to the beach. I want to know how that's going and if there are plans to allow more people on the sand in the near future.
Well, it's going well, Keith. This past weekend was probably our first test on Saturday. Sunday, the weather wasn't nice, so we were washed out. But on Saturday, the beaches were very full, and we had over 300 law enforcement officers from the north part of the county, Fred Howard Park, all the way to the south in Fort DeSoto. And Clearwater was very heavy, Pass Grill was very heavy, Dunedin Causeway was very heavy, and we're managing it. And that's how we're having success, because we're actually closing sections of the beach. We're not allowing it to get dense, and we want to make sure that we abide by all of the recommendations and the orders are in place to make sure that people stay 6 feet apart, no more than groups of 10. If it wasn't for the presence and it wasn't for managing it, then we'd be like they are in other parts of the state where they open the beaches, now they're closing them because it isn't working out. So we're going to keep this level of staffing up through Memorial Day. We have this weekend coming up, then of course the 4-day Memorial Day weekend. But what we need people to know is it's not business as usual. Don't just come and get in big groups like you were before and have big parties on the beach. We want people to come. We want them to enjoy the beaches. We want them to patronize the businesses, but it's got to be done in a way that is safe. And I don't think at this juncture, I agree with what Mayor Kreisman said, data is super important. We want to make sure that 2 big factors. Number 1 is the number of new cases every day is not increasing based on the measures, and the percentage of positives stays where it is or goes down. Of course, that's what we want to see. But I'm a big believer in that we need to drive it off the data. That right now, we need to keep doing what we're doing.
Congressman Crist, I want to go to you next. I mean, and if you can be a little reflective here, because you also served as governor. What kind of pressure is Governor DeSantis under right now to get all of this right? I mean, he has to help control the spread of a killer virus while trying to save Florida's economy, get people back to work. That's not an easy thing to accomplish here. Your thoughts on that?
I couldn't agree with you more, Keith. It's not easy at all. It's like trying to thread the needle, when you're trying to throw a completed touchdown in a football game between 2 of the best defensive backs you've ever seen. And the challenge here is that both are important, clearly. Life is more important, obviously. And so what you want to do is be responsible, be prudent, be measured. I think that thus far, the governor's done a good job with the rollout of reopening. I think that doing it slowly and doing it in a measured fashion is exactly what we need to be doing. I thought he could have been a little more expeditious at the outset of the issue generally, but I think he's been a quick study, and I credit him for that. But it is not easy. The two things that I really had challenging myself when I was governor was the BP oil spill, the largest environmental disaster in the history of our country. And at the time worked hand in hand really with President Obama as then a Republican governor. And I think that's one of the important things to mention is that this has to be bipartisan. Republicans, Democrats, independents can all get this virus. We have to be cognizant of that fact. We're all Americans. And we have to work together and pull together no matter what level of office we're talking about, whether it's the president, the governor, our sheriff, the mayors. The right thing to do is to do the right thing and look out for each other and make sure that we keep God's countenance close and that we understand that doing the right thing and really adhering to the golden rule. Do unto others as you would have done unto you. Making sure that businesses are safe, that people are safe, that social distancing is being practiced. You know, it's just use common sense and do it right.
Congresswoman Castor, I want to go to you next because I know you support the proposal for a $3 trillion stimulus relief package. This would also include a second round of stimulus checks. I've been reading more about that. Some believe we ought to wait and see how the trillions already approved in the CARES Act is working before you move forward with another stimulus plan. You've had several announcements actually about the millions already coming to the Bay Area. Talk a little bit about how that money that we're already getting is helping and why we need this new round of stimulus.
Yeah, Keith, we really can't wait. The virus is not waiting. This public health emergency, we can't put it on pause. So what the Congress has aimed to do in a bipartisan fashion is speed emergency resources back home to our neighbors who really need it. That's what that $1,200 direct cash assistance payment was intended to do, with a little bit of help for kids as well. Then the assistance to small business owners through the Paycheck Protection Program or the emergency disaster loans. Those have been lifelines for a community like ours, where the backbone of our economy is our small business owners. So we intend now to put together another emergency aid package. It's the HEROES Act to boost our frontline heroes, the police officers, the firefighters, the first responders, the healthcare workers, and our local communities and states. You know, if back when Congressman Chris was governor, if we hadn't had the Recovery Act, we would have had massive layoffs of teachers that would have trickled down and caused a unbelievable collapse. We don't want that to happen. We want to make sure that our teachers stay employed and on the job, get ready for the next school year. The other important piece of the HEROES Act will be a broad-based testing initiative. The testing has to happen at the local level. We've done fairly well here in the Tampa Bay area, but the federal government has an important role to play on the supply chain to make sure that the supplies get down to states and local communities and that we're transparent in where the cases and infections and mortalities occur. That kind of transparent reporting is absolutely vital to contain COVID-19.
And this is something we're going to be talking a lot about because, as Congressman Chris mentioned, I mean, this is going to require bipartisan support to actually push it through. And I know you're going to have an announcement about this, Congresswoman Castor. Maybe tomorrow you're going to talk a little bit more about this, making news with it. But I want to go to State Senator Roussan here for this next question. You were in favor of holding a special legislative session that was devoted to the coronavirus crisis, in large part to address the state's broken unemployment website. We have so many people who are unemployed in Florida, but that session's not going to happen. We know that now. What advice are you giving the unemployed workers in your district calling about the delay in getting the money they need to survive? What do you tell them?
I tell them to be persistent. They've run out of patience, and all of us understand that. People are angry, they're frustrated, they're living with anxiety, with fear, with loss of job, grieving sometimes because of deaths that is occurring around them. And all we can do is tell them be persistent. Keep trying at it. We're making progress, but progress does not meet everybody. There are 51% of the people of the claims that have been filed that have not been paid yet. 1.8 million claims, 1.3 million of them unique claims, 715,000 of them still unpaid. We need solutions, and that's what the people want to hear. They don't want to hear partisanship slamming each other. They want solutions. So I say we need to update and overhaul the system. We need to sufficiently staff the call centers and train them. We need to credibly put forth shortcuts to get people paid. People want their benefits, and we need to hold people accountable for failure to meet the goals that we set to get people benefits.
And your advice for all those calling you, be persistent. Mayor Christmas, I want to go back to you, sir. I want to get your thoughts about efforts to protect the most vulnerable in our community here. I mean, we've heard 35% of all COVID-19 deaths have been in nursing homes, either from residents or workers. We've heard from families who've been calling us here at 8 on Your Side saying they feel they've been denied full disclosure about what's happening to their loved ones. Why is it so hard to get basic information about outbreaks and about what's happening in those facilities?
A lot of the information comes down first from Tallahassee, but you know we work really closely with the Pinellas County Department of Health, and they've really been focused on our assisted living facilities, our nursing homes, those homes that provide the long-term care to our most vulnerable residents. And so, at least in our county, and I know Jane can speak to what's happening in Hillsborough County, there is a real concerted effort to make sure that those who are the most vulnerable are really taken care of, that we're getting the testing that they need, they're getting the medical treatment they need, the hospitals, if they need to be transferred, that's occurring. So at least in Pinellas County, we're working really hard to try and get that information out, because we know that's one of the hardest parts for families is they oftentimes they can't have that contact with that loved one. And so the more information we can provide to them, that at least the easier it is on the families to know what's going on with their loved one.
And we're at crisis level with these nursing homes and assisted living facilities. Out of the 3,800 facilities in the state of Florida, they represent 44% of the COVID deaths. And it's inexcusable to not give information so people can make informed decisions about their health and their loved ones.
Thank you, Senator. Mayor Kreisman mentioned you. Mayor Castor, I want to go for you with this next question, because I want to play a question here. This is actually from one of our Tampa viewers along these same lines. She's concerned about something we've all mentioned here, and that's coronavirus testing. See if you can hear this question.
My mother's in a nursing home here in Tampa, specifically the Bristol, and I'm very concerned that she's only been tested once for the COVID virus, and it's running rampant over there. She was tested back on May the 2nd. It's now May the 11th, and I still have not heard the results of the testing. I'm also concerned that that's only a one-time test, and with as many cases as they have there, why aren't they testing residents every day?
So, Mayor Castor, how often are nursing homes testing?
Well, that's a good question. How often do we test, period? Here in Hillsborough County, we are supposed to have 2,250 tests a day based on our population, and we aren't anywhere near that number. And then if you look at the high risk, this has been a focus of ours from the very beginning. The first place we went to were the nursing homes here in the city of Tampa, the long-term care facilities. But, you know, the caller is correct. You can be tested today and then contract the virus tomorrow. And one of the issues as well is how long it takes to get those results back. We're looking at 5 to 7 days. And by the time, especially in a very high risk environment like these long-term care facilities, you know, 5 to 7 days can mean the difference of life or death for the entire unit. And one of the issues is the high risk or the long-term care facilities that house these high risk patients. They can be taking every single precaution, and they can have employees, staff that come in that are asymptomatic and are carrying this virus and passing it without knowing. And so that is one of the areas that we have really fallen short on. are the number of tests that we're providing and the time with which we're getting the results back on that. It's getting better every day. I credit Jarrett Moskowitz, the state EM director. He is doing everything that he can. But on the federal level, the entire testing process has been woefully understaffed, and the supplies are just not where they should be.
Congressman Christ, I noticed you nodding your head in agreement as Mayor Castor spoke there. You announced $1.1 million in federal funding for coronavirus testing, specifically in minority and low-income communities in Pinellas County. Do you believe these communities have been overlooked?
I do think so. And you know, my friend the senator is very aware of how the minority communities are affected in the Tampa Bay area generally. But, you know, the fact of the matter is, if you don't have equality in how you are using resources across the board in our nation, let alone the state of Florida, you have a significant problem. And it's discrimination. I don't know how else to put it. You got to make sure that you put the resources into every single neighborhood all across America in a fair and equitable way. Otherwise, you're just not doing what's right for the American people as a whole. And that's not fair. It's not right. It's unjust, and it must stop. And I believe that it will. I'm optimistic. I want to compliment Kathy Castor, my sister in Congress, if you will, who I enjoy working with so much because she's so good and so honest. The fact of the matter is, this bill coming up on Friday that we'll vote on is another $3 trillion. She's exactly right. And that has to keep coming. You know, included in there, as she mentioned, is $1,200 more for those Americans who make less than $75,000 a year. And we have to make sure in that legislation, it's 1,200 pages, so I haven't had the chance to read it all. It just came out this afternoon. But at any rate, there was a loophole that said that college students or those that were 18 or 19 years old couldn't get those checks. We have to make sure that that's made right, that those students and young people are made whole.
State Senator Rassam, you might want to elaborate on that if you would like, but because we're pressed on time, I'd like to talk to you a little bit about education, because I'm wondering what the state is doing now and what the legislature can do going forward in the future here to help when it comes to get the education system back on track so the children and their teachers can actually safely return to the school buildings. Can you offer some reassurance to parents that things are going to be okay?
Well, all I can offer is that we need to have a measured approach to reopening schools. We need to make sure that our children are safe, and this decision needs to rest on the scientists and the medical doctors, the physicians, not professional educators. I think that Congressman Christ is right. In the year 2000, the state of Florida created the Office of Minority Health because they recognized there were health disparities and disproportionate impact in low-income and Black and brown communities. That $10 million that started the Office of Minority Health eventually dwindled down to less than $3 million. And we beefed it up a little bit this year, but the social discrimination has led way to medical discrimination, and we need to stay ahead of that curve. But I will assure you that the superintendents of these various school districts are working hard to make sure our children are safe. My wife and I have 5 young men at home, and they're anxious about school.
You bet, and a lot of parents feel the same way. Congresswoman Kathy Castor, let me go to you for that similar topic here. Will everyone need to be tested before they go to college? And if they're tested once, when they go back in the fall, how often does that testing continue, not only for the students, but for the faculty?
Yes, widespread testing is absolutely necessary to fully reopen the economy, to get kids back in school, for our neighbors to feel safe. And on the education piece, that's why the HEROES package that has just rolled out of the House of Representatives is so important, too, because a bulk of the federal money will go to the state of Florida to supplement their budget for teachers and education. You know, Florida is, we often struggle with folks in Tallahassee that supplant federal money that we send, and then they just back out the dollars. Here we want to add a requirement that this emergency aid money supplement, that it comes on top so that teachers do not lose their jobs, so that we can make sure that our students have every resource they need. And the testing back to the skilled nursing centers we know now these areas of vulnerability. We have a disproportionate impact in many communities of color and in skilled nursing centers and prisons. So yes, you focus the resources there. The good Channel 8 reporter, Masha Saidi, has done some great reporting on this, and she will be pleased to know, on behalf of all of the skilled nursing resident families that she's talked with, that this emergency aid package will require greater reporting by skilled nursing centers directly to the Centers for Medicaid and Medicare Services and the Centers for Disease Control. And those nursing homes will have to inform family members within 24 hours if there is an infection or some serious problem. And then if these skilled nursing centers don't report, there'll be serious action.
Sheriff Gualtieri, I haven't forgotten about you. I want to circle back to you and talk about some of the challenges that come with policing these rules and regulations that are still in place as we're still in phase 1, not quite to phase 2. We got this question from a viewer who asked, if bar seating is still not an option and restaurants are to be at 50% capacity, how do you account for the sardine effect, most notably at Ferg's and Lure, and why is there no accountability there? That's the viewer's question, but you know, I know you've proven that you're willing to make an arrest when necessary. How do you decide when to enforce some of these rules and when to educate?
Well, education first and foremost, Keith, and it's 25%, not 50%, that's allowed in the restaurants. You know, I think for what we've seen, by and large, most people are trying to do the right thing and are accomplishing that. There's certainly times there's one-offs. A lot of it also, people have to be careful about perceptions, because remember, is that when people are in groups, what the law is that groups of no more than 10. So if you see 6 or 7 people, if they all arrived in the same car and they're all part of the same family, and what we do is we get complaints that people say, first of all, it's groups of less than 10 that people have to stay in. And when you see families together, it's okay. The greatest challenge we've had is with consistency, and to make sure that it is consistently applied across the county. And people have a hard time understanding the rules. Some of them have been kind of complicated, and the governor's safer at home order is very hard to understand. People were looking for what you could not do, and all it told you is what you could do, and everything else fell into the you can't do category. So that was very hard for people and hard for businesses. But, you know, by and large, we are seeing compliance, and people are really trying. We're seeing it on the beaches. We're seeing it on the restaurants. We're seeing it in the businesses. We still have a call center and a tip center that's set up here in Pinellas, but the number of complaints has really gone down in the last week or so. So, you know, we really want to make sure it's done consistently, but by and large, the community is adhering to it.
I'd like to go to the mayor as we near the end of our half hour here. I'm just wondering if you've had time yet to calculate the financial loss for your cities, and will your cities be able to recover these losses? I mean, will it be resulting in higher taxes, reduced services? What's the financial impact here? We'll start with you, Mayor Castor.
Well, we aren't going to reduce services or raise taxes. We have had plenty of budget meetings. Matter of fact, we had our entire senior staff down at the convention center for half a day Saturday before last, going over our 2020 budget, seeing what we could, you know, with a fine-tooth comb, seeing what we could pull out of that budget, projects that hadn't been started, positions that hadn't been filled. And we're looking at a number of approaches for 2021 budget. Clearly, it will be much more austere than we thought it was going to be, but we're also looking at some restructuring of bonds and things. So we feel that we'll be okay here in the city of Tampa, but really 2021, 2022, 2023 are going to be difficult years.
You feel the same way, Mayor Kreisman?
Oh, yeah. A lot of lost revenues that we from sales taxes, utility taxes. There's a lot of fees the city was collecting that we're not collecting right now. So, you know, we are fortunate that we've over the last 5-10 years, there's been a concerted effort. Certainly, my administration has made it to invest in our reserves, to each year try and come in the black if we could, and it's really made a difference. Mayor Castor and I are on phone calls every week, and with mayors from around the country, and we're hearing the financial conditions that a lot of those cities are in, and they're far worse than what we are experiencing, fortunately for us. But having said that, we're going to have to look at every line item, every potential hire, or every position that's open. Do we refill it? Is there ways of us becoming more efficient even than we have been? So this budget's going to be tight finishing this year. FY21 is going to be tight. FY22 is going to be tight. We're going to do what we can to not raise taxes also.
Final question before we go. I just want to get your thoughts on whether you think there's actually going to be a second wave here for this virus, or do you feel like the cities are ready and the Tampa Bay area is prepared for whatever comes next? Real quickly, just around the horn. We'll start with you, Sheriff Gualtieri.
Of course, it's a concern. You know, we hope it doesn't happen. I know we'll be better prepared than what we are and have been. But of course, it's a great concern, and it's a real possibility. So it's something, and that's why we have to be careful about not moving too fast and measuring it, so we know if there is a problem, we know what's causing it. If you just dump it all in the bucket, then you can't figure out what the cause of the problem is. So we need to do it incrementally so that we know what the cause and effect is.
Okay, State Senator Rasan, I'll let you chime in there, and I'm going to probably have to end it there. What do you think? Second wave.
I agree that if it does happen, we will be better prepared. May is National Mental Health Month, and we need to remind people to take care of themselves and reach out to somebody.
All right. I would once again want to thank every one of you for joining us here on our panel. Very helpful to take your time to do that. We also thank you at home for joining us, and for everyone who's been watching online as well. We appreciate your efforts for sending us in questions. Perhaps we'll do this again another time, but for right now, I'm Keith Cate. Thank you so much for joining us for this special. We'll see you back here tonight for News Channel 8 at 11. Good night and be safe.